Today I'd like to talk to you about low back pain. And just about everybody has suffered from low back pain at one time in their life or another. And also, it keeps people from going to work. There's more absenteeism caused by back problems than just about any other illness that you could mention. So I wanted to just give you a little bit of an insight into what causes this low back pain. And we've talked earlier about the foot, the ankle, the knee, and the hip. And when these body parts are out of alignment and the hip joint has rotated out of its normal position, it almost always does this on one side more than the other. When this happens, the pelvis is no longer level. So when the pelvis is not level, it's on an angle, it causes the lumbar vertebrae, the L5, L4, L3, it causes them to tip, tilt, and rotate. When this happens, it impinges on the nerve supply going to the abdominal, gluteal, and quadriceps muscles. These muscles then are to some degree turned off. Not enough that you can't get up out of your chair and walk, but they're not functioning at their full potential. When they're not working at their full potential, the psoas muscle becomes too tight, and this muscle pulls down on all 5 lumbar vertebrae. This causes ongoing disc degeneration, lack of circulation to the disc, and it affects the nervous system even further than what it is affected just by the tipping, tilting, and rotation. Now there's compression to add to that. When the disc becomes affected and it begins to bulge, herniate, it will push on the spinal cord and it'll push on the nerve root. When this happens, it causes pain, but not at the point of the injury or the pressure on the spinal cord or the nerve root. It doesn't cause you pain until you feel it in the torso muscles, in the sacroiliac joint, in the hip joint, in the gluteals, down the leg, the thigh, the knee, the lower leg. It could manifest as sciatic radiation. It manifests as that. And then you have the pain and you're wondering where it came from and what to do about it. Well, what we want to do in this case is go to the cause. We want to realign the foot, the ankle, the knee, the hip, and the low back, and go directly to the cause. If you would like to know more about this, please call my office at 905-528-2218 or go to my website, orthoticstogo.com, watch the videos, listen to the testimonials. And my name is Sylvia Shackleton. I'd like to thank you for listening to this brief message about low back pain.